You're watching Startup Central with me, Nayantara Rai. During the second wave, or a tsunami if you want to call it that, of COVID-19, we have been featuring new age COVID warriors. People who have been volunteering their time and money. They could be startups, they could be entrepreneurs, they could be professionals, employees who have decided the most important thing for them is to beat the coronavirus. Today, the COVID warriors that we are featuring are Tehseen Poonawalla as well as his wife Monica Vadera. You see them very often on social media helping out those that need to find oxygen bed, need to find oxygen concentrators, who need to find plasma. And they're doing this across the cities. They clearly have many foot soldiers whose help they're taking. So let me go across to our COVID warriors today, Tehseen as well as Monica. Welcome to Startup Central. Tehseen, I'll come to you first. You both, the couple that you are, have decided this is the most important thing is for everybody to see on Twitter, on social media. How have you used social media and how are you finding these medical supplies? How are you finding all of this?
So two things. We've used social media as a tool to make sure that the voice of the common man reaches the last mile. Now, not everybody is, for example, on Twitter, but a lot of India's population is on WhatsApp. So it's not just social media with regards to Twitter, which is what is generally seen or is more visible, but it's also a number of WhatsApp messages that Monica, me, and our team get. And I must say that the WhatsApps, for example, are about 100 times more than what we get on Twitter. So that is how we get the information. We set up a dedicated team. Monica's in charge of that. We segregate the information on who requires what. It's plasma, it's oxygen, it's a hospital bed. And then we have teams that follow up with the concerned department to try and procure that. I must confess here that because Monica and I do have a network personally, we do use our personal network to make calls and to sort of secure something for somebody if we can help save a life.
So Monica, how does it work? So you both get requests on WhatsApp, you both get requests on social media. Do you have a team that filters through it? Because there will be some that will be far more pressing than others, far more urgent than others, far more reasonable to be able to fulfill than others.
Yes, so what we essentially do is as soon as we receive a request, we ask for them to send across the medical records and the phone number of the attendant. And in our team, I've assigned roles such as, a team member will immediately then call up the attendant, check what the present situation is, check in case they've received another, help or assistance from another person or another individual. And if not, also again, depending on the condition of the patient, the saturation levels or the urgency, we then immediately consult doctors or consult hospitals and see if we are able to help them. So we have set up a little algorithm of sorts when it comes to answering or tending to any inquiries that come or any SOS that comes.
So Tehseen, I've very often read also on social media where they say, how is Tehseen organizing all of this? Do you want to answer them, whether, it is in Kolkata, whether it is in Indore, whether it's in Delhi?
That on your sister channel. And I'm going to be a little cheeky here. I said they should allow some of us to run government. We'll do a better job, but I don't want to. But it's only a question of picking up the phone and making a call. And Monica and I believe that if a phone call can save a life, we must make it. So there is no time limit. People call us at 2 a.m., 3 a.m. and try making calls. The second thing is you got to reach out to people and you got to make sure that, the right person at the right time. So, for example, when oxygen was running out of hospitals in Delhi, I would call up everybody from the DM to the SDM to the state ministers to the central bureaucrats. It's about picking up the phone and making a call. You need if there could have been an authority in the country that could have done it would have been better. But we just pick up the phone and make a call, and then we feature it out. Or sometimes we get links and then we make the further calls.
So Monica, there is no machinery behind you guys. Is this the two of you who are doing this?
No, I have a very solid machinery behind me. I'm blessed with that. I have my employees, I have volunteers, I have other influencers. We have a very, very large group. My foundation, we have about 50 people that work. and they're working 24/7 at present in different areas to do with the pandemic and crisis help centers, etc., within the foundation itself.
And these are people who are online. Then we also have people on the ground. So people who can deliver the oxygen, who can pick up the concentrators, who can go to the vendors, who can distribute food. And now we've tied up with one more service. So it's starting with Delhi, that anybody who needs to go for a COVID-related activity, but himself or herself is not COVID positive, especially senior citizens, they don't get cars. We'll arrange a car to pick them up from home, take them to the hospital, the oxygen center, or the medical store, and bring it back. So we've even started that.
So it's a free of cost transportation service to help people during COVID.
So Tehseen, right now we're still firefighting for medical supplies. The situation in Delhi has normalized, but if you go on social media, you're hearing about how other cities are crying out for help. Whether it is Kolkata, Goa, Bengaluru, the attention has shifted there. Would you say that that's where most of the calls, most of the help, the SOS is required?
Yes, I divide your question into two parts. Delhi hasn't normalized. The oxygen supply has increased because of the Honorable Supreme Court stepping in. So 700 MDs coming to Delhi. But now Monica and I are getting a lot of calls for Delhi for ventilator beds and ICU. Even as I speak to you, I'm on my phone trying to arrange ventilator beds for people you and I may perhaps know, their relatives. So the ventilator situation in Delhi is extremely bad. But you're right about Kolkata, about Goa, West Bengal, Goa, Uttarakhand, and Uttar Pradesh. I see a crisis growing there simply because there's less oxygen supply, there are less beds, and there's less testing. I'm very scared about Uttarakhand and Uttar Pradesh because because Uttarakhand has a porous border with Nepal, so we need to be extremely careful with what we're doing with Uttar Pradesh, Uttarakhand, and Goa. I think that's scary. In West Bengal, we know what happened with the elections.
The issue is that there is the emergency aid and anything. There's a lot of restrictions because transportation is not as easy. So that's one of our biggest worries that, God forbid, should something go wrong and a crisis arise, how will you get help in time to those who need it?
That's true.
Okay. And, you have a Poonawalla Foundation, Monica, but for a lot that you're talking about people on ground, the logistics, the actual delivery. How is all of that being funded?
Ours is a philanthropic organization. We are fully self-funded. We also have vendors who come on board. They want to do their bit, give back. So they sort of give something at cost. They give a lot of things at times without any cost. We have a concentrator vendor who's got concentrators and he's giving them at the basic price. He's not adding anything on top barring the GST. So we have been fortunate enough to have partners, but we try doing as much as we can because I feel, and Tehseen feels as well, that, since you've been blessed with so much, you should always give back when needed.
Your duty bound to share.
Tehseen, this is a time when we've actually seen citizens, whether they're entrepreneurs, founders, startups, professionals, employees, come together to help one another. You both have also been doing that. But going forward right now, while the SOS and the major crisis is for medical supplies and supplying all of that, going forward, as we rebuild for a post-corona world, we're still going to need a lot of effort. Families they've lost earning members, they've lost jobs. How do you see all of this being done? How do we rebuild? Or is it too early to even have this conversation?
No, we need to have this conversation. And just last night, you brought this up just last night, Monica and I were discussing this. We know of children who've lost both their parents. We know of a lot of old fellow citizens who've lost their children because the second wave has hurt a lot of youngsters because they were not vaccinated. So there has to be a national plan to how to rehabilitate these fellow citizens. Another problem that Monica and I foresee that will happen is a lot of the black fungus problem and the requirement for EMTs to start solving that problem and medical care for that. Right now we're firefighting. Nobody's planning for the problem that's going to face. A lot of emergency that right now we're facing is, again, cases of black fungus, ENT consultation, So we will need to have some sort of a real-time database of how we can deal with the post-COVID medical complications and post-COVID rehabilitation. Both of these will need to be dealt with, both at the central level and at respective state levels.
Okay. With that, more power to you guys. Keep up the good work. Thank you so much for taking the time out, for joining us live on this edition of the Startup Central. Thanks a lot for all that you're doing. Those are the COVID warriors that we had today on today's show, how they're using social media as a big tool, WhatsApp and all of that, to just rush medical supplies to those that ask for help. With that, it's a wrap. Many thanks for tuning in. We'll see you same time tomorrow.